All right, welcome to The Explainer. Today we're going to talk about a disease that's spread by an insect with a surprisingly charming name, the kissing bug.
It's a pretty wild paradox, right? A kissing bug. The name sounds almost sweet, but the reality is that this kiss is actually the starting point for a really serious and often totally overlooked global health problem. We're talking about something that affects millions of people.
Okay, so to really get a handle on the danger that's hiding in that kiss, we first have to meet the tiny, microscopic culprit that's at the heart of this whole thing.
So, what we're talking about here is Chagas disease. It was named after the guy who discovered it, Carlos Chagas, and it's a lifelong parasitic infection if you don't treat it. And that's the key word here, lifelong. For a long time, it was mostly found in Latin America, but now, because of migration, it's become a global health issue. You can now find hundreds of thousands of cases in places like the US and Europe, and a lot of them are completely silent.
And this little guy is the one we're going to be tracking. Trypanosoma cruzi. It's a single-celled protozoan parasite. You can almost think of it like a master of disguise. It's got this really complex life cycle that takes it from the bug into a person, and then it just hides, sometimes for decades.
So you're probably wondering, how does this parasite actually make the jump from a bug into a person? Well, the journey it's fascinating, but honestly, it's also a little bit creepy.
Okay, this is a super important detail, so listen up. The infection doesn't actually come from the bite itself. Here's what happens. The bug bites you to get a blood meal, right? But then it poops right there on your skin near the bite, and it's the parasites inside the poop that cause the infection. Usually, you don't even know what's happening. You just instinctively scratch the itchy bite, and in doing that, you accidentally rub the parasite-filled feces right into the wound, or maybe into your eye.
So once it gets inside your body, the parasite shifts into what's called its trypomastogote stage. Just think of this as the parasite's little mobile unit, its scout. It's got this tail-like thing called a flagellum, and it uses that to zip around in your bloodstream, actively hunting for your cells to invade.
But once it finds a cell and gets inside, it completely switches gears. That moving trypomastogote morphs into the amastogote stage. It drops its tail, hunkers down, and it has only one job now, to multiply. It just copies itself over and over and over again through binary fission, until the host cell is so full it literally bursts open, releasing a whole new army of those trypomastogotes back into your blood.
And this whole cycle is what makes this parasite so incredibly tough. Because the cycle starts all over again when a new, uninfected bug bites an infected person. Inside that new bug's gut, the T. cruzi parasite transforms again, this time into what's called the epimastogote stage. And in this form, it multiplies inside the bug, just waiting to get passed on to the next person. It's just brilliantly adaptable. So we've seen the parasite's crazy life story. But what does that journey actually look like from inside the human body? Well, it turns out Chagas has two very, very different faces.
Yeah, this really shows you the split personality of this disease. You've got the acute phase right at the beginning. We're talking the first few weeks or months. And during this time, your blood is just teeming with parasites. That's a condition called parasitemia. But here's the crazy part. The symptoms are usually super mild, like a fever, or you might not have any symptoms at all. Then it shifts into the chronic phase, and the disease just goes completely silent for years, sometimes for decades. And that's when the real devastating damage starts to happen.
Now, there are a couple of classic signs you can look for in that early acute phase. One is Ramagna's sign, which is this really distinct swelling of just one eyelid. The other is a chagoma, which is a swelling right where the bug bit you. But here's the catch, and it's a big one. These visible signs are actually pretty rare. So for most people, that critical window of about 8 weeks when the disease is easiest to diagnose just slips by, totally unnoticed.
And that is exactly why it matters so much. Look at this number, 20 to 30%. That's about 1 in 4, maybe 1 in 3 people with chronic, untreated Chagas who will eventually develop life-threatening problems, years, sometimes decades after they were first bitten. And the most serious and common of these issues is something called Chagasic cardiomyopathy. Basically, the parasite's presence over all those years damages the heart muscle. It gets weaker, it gets bigger, and it just can't pump blood effectively anymore, which can lead to heart failure or even sudden death. And it's not just the heart. In some people, it can cause major gastrointestinal problems like megaesophagus or megacolon, where your esophagus or colon literally become massively enlarged.
Okay, so this brings us to the bigger picture. We've talked about the person, but how does this become a global challenge?
Well, it's because Chagas is what's known as a neglected tropical disease.
And man, Chagas fits this definition to a T. It's what you'd call a disease of poverty. It hits people the hardest who live in poor housing conditions. Think about houses with mud walls or thatched roofs. Those are the perfect hiding spots for these kissing bugs to live and thrive.
And here's where it gets really frustrating. You'd think that when people move to developed countries, like the US, the neglect would stop. But it doesn't. This quote from Peter Hotez really hits the nail on the head. Doctors just aren't trained to look for it. There's this huge awareness gap in the medical community, and it means hundreds of thousands of cases are just flying completely under the radar.
So how do you fight a silent killer like this? What's actually being done about it? And what are the biggest hurdles we're up against when it comes to diagnosis and treatment?
This timeline really lays out the core of the problem. It's like a race against the clock. For the first 8 weeks or so, the acute phase, it's relatively straightforward. You can actually see the little trypomastogotes swimming in a blood sample, or you can use a sensitive PCR test. But after that, poof, they disappear from the blood. So for the rest of a person's life, you have to rely on serology, which means you're not looking for the parasite itself, you're looking for the antibodies your body made to fight it, using tests like ELISA or IFA. It's way less direct, and you often need 2 different positive tests just to be sure.
And the treatments we have, benznidazole and nifurtimox, they perfectly mirror this diagnostic problem. It's a cruel irony, really. They work incredibly well. We're talking up to a 90% cure rate, but only if you catch the disease in that tiny acute window. By the time someone has chronic damage, like cardiomyopathy, the drugs can still kill the remaining parasites, but they can't turn back the clock. They can't fix the damage that's already been done to the heart.
So you see, tackling Chagas isn't just one thing. It's a war on multiple fronts. You have to control the bugs themselves, which is incredibly hard in huge places like the Amazon. We desperately need better, faster tests. We have to be proactive about screening people, especially pregnant women, because it can be passed from mother to child. And we have to fight the poverty and lack of access that keeps people from getting help in the first place. Not to mention the need for brand new drugs for that chronic stage.
This quote from Dr. Jaime Alche, it just says it all, doesn't it? An infected adult is a child that went untreated. It brings the whole challenge into sharp focus. If we want to prevent a lifetime of suffering, a lifetime of irreversible heart damage, it all comes down to one simple thing. Find and treat this infection when people are still kids.
Which really leaves us with this final critical question. A disease that silently destroys the heart, that affects millions of people, but mostly people who are poor. How do we get the world to pay attention? How do we make people listen before it's too late? It's the same question at the center of the fight against so many of these neglected diseases that just fester in the shadows.
I really hope this has helped shed some light on what is a really complex and super important topic. Thanks so much for tuning in.